Hi, everybody. I'm Linda Johnson. I'm a 7.5-year Mets patient. Don't touch the podium. I wanted to take a minute and see how long everybody's been with us. And congratulations for making it today. It's nice to see such a big group today. If you've had Mets for more than 10 years, where's Ginger? Please raise your hand. More than 10. Okay. How about more than 8? More than 8 years? Only a couple. Okay. More than 5? A few more? 3? We've got new people. How about 2 years? Newly diagnosed. Okay, welcome. I want to tell you, I know that it's luck that I'm here. A lot of it is luck. But I think that I improved my chances by participating in an exercise program that I was offered through the Claremont Club for any cancer patients. It's absolutely free. And it got me started doing something I didn't think I'd ever do, which is exercise in a pool, in a bathing suit. Which, believe me, is more horrifying than you can even. I wanted to let you know that, especially you newly diagnosed people, if you get on Medicare, there's a program called Silver Sneakers that's free that can get you into a gym. I urge you, if you have any inkling at all, to do something to help yourself. I'm listening to Rachel knowing I should be eating better. We know that. I'm not willing to do that just yet. But I was willing to get in the pool. And I hate it, but I've lost 20 pounds and kept it off. And I still hate it. I also wanted to talk to you, something that Dr. Stanton brought up. She said accept help when it's offered. The thing I wanted to nudge you towards is to accept help in something creative that you've never thought you could do or you thought about doing and you just haven't. If a friend or a sister says to you, what can I do for you? Think about did you always want to learn to sew? Did you want to take a class in photography? Did you want to do something? Do it. I didn't think I'd have the time to get as far as I have. I do mosaics. And I brought something with me I'm going to show you. It's not totally finished. I made it for the gym that gave me this program. So it basically shows a pink ribbon that is dissolving in the water, and it has a salt shaker that started life as a salt shaker. It's me. It's a fat lady in a bathing suit. We're going to hold it up. Sure. Thank you very much, ladies. It's not glued yet. The top is the club's logo. That's why it's there. It's not totally irrelevant. But the logo is, the pink ribbon is kind of dissolving in the water. That was my point, is that take a little control back. We have no control over anything. Control something. Something, if you can. I know nobody feels like doing it. I don't either. I still don't. But it helps. I wanted to also tell you I'm on Exgiva for bone strength, and I fell about 12 days ago, dislocated my elbow. And look at me. It hurts, but it didn't break. I've been worried for years that I'm going to fall and break something. Guess what? Let some of those fears go. My doctor said she thinks it's the Exgiva that kept it from breaking. Maybe, maybe not. I do want to say the ASCO guidelines. ASCO, American Society of Clinical Oncologists, yes? The recommendations for Exgiva is a bone strengthener every 3 months, not every month. So most of my other patients that I know of are taking it every month. You don't need to. It leads to ONJ, osteonecrosis of the jaw. We want to try to reduce that if we can. let's see, there's something new called a liquid biopsy, I was told recently. I wanted everybody to know about this in case you have something that's hard to biopsy. They can do a biopsy with blood or urine now. Yeah, this is new technology that's really helpful. I have tumors in the pleura of my lungs. They can't biopsy them because it would possibly pop a lung. So this is great news for me. Let's see. I think that's it. Okay, well, another thing I'm passionate about is my relationship with my doctor. And I happen to love my doctor. She's at City of Hope. Something that's important is thinking about getting a second opinion if you need one. I was raised, my mom worked in a hospital my whole life. She revered doctors. You did not question them. I think things are changing in a lot of ways for us. It's time to question, not in a bad way, but in a good way for you. So I have someone here named Lisa Bernstein. She's a 3-time invasive breast cancer survivor. We don't like that word, some of us. She's an e-patient advocate. She's an advisor to psychosocial oncology startup CanSurround, is a new thing. She was featured in the LA Times article, "A Second Opinion Could Save Your Life." So help me welcome Lisa. Thank you.
Thank you. Thank you. Thank you so much to Linda and to Sharon and to all of you for having me here today. I'd like to give a huge shout out to Linda because there was no contact information for me in the article, but she figured out, she's a very resourceful and persistent lady. She found me and she got me here, so thank you so much. The best kind, the best kind. Anybody in this room, has anybody in this room ever felt intimidated at the doctor's office? Anyone? Okay. Has anyone here in this room ever felt that they might value peace of mind? Right? I mean, it's obvious, right? It's obvious, except that it isn't. And I found myself part of what is called the e-patient movement. And oh, I'm at this thing here. Okay, the e-patient movement, where E stands for engaged, empowered, and also using like email, like electronic media. And it's also about being educated, and for me, about educating others. And one of the most important things is about being a partner in your own care. The first time I was diagnosed with breast cancer, I was 29 years old, and it was diagnosed through a frozen section biopsy. I was told by the surgeon when I woke up in recovery, you have cancer. I had a follow-up with him. I had a follow-up with a radiation oncologist. You know, they put me in the system. And as I said, I was 29, and all of these doctors said to me, oh, it's extreme. This was 1994. Now you know how old I am. All of these doctors said to me, it's extremely, extremely likely that they're going to prescribe chemo for you because you're so young, etc. I finally go to see the medical oncologist who was part of this hospital system, and I was still sort of on Vicodin, still completely reeling from what was happening to me, but somehow, this was before the internet, I'd managed to do a bunch of reading and find out about the drug tamoxifen. Hold the thought. So I go see this doctor, and he's got all of these ego photos on the wall. I know I sound biased already, but you know, and he's sitting back, and he's like, "You're fine, you can go." I'm like, "What? No, you're fine. I don't need chemo." No, you don't need chemo. And I'm like, "Well, I've heard about this drug, tamoxifen. What's up with that?" He said, "Well, do you want tamoxifen?" I'm like, "I don't know." He's like, "All right," and he prescribed tamoxifen to me. Not joking. So, thankfully, we had this family friend who was a very, very pushy lady. And she said to me, "You need to get a second opinion." And I was, again, very, very intimidated. I mean, after all, this guy's the doctor. I don't know from cancer. And there was no cancer in my family, so I was never exposed to anything about it. And, so, you know, and all the other doctors who I went back to see for follow-ups were like, "You should get a second opinion." So finally, I got a referral, and I went to see an oncologist who is still my oncologist to this day, Philomena McAndrew, if any of you know her. And the first thing Philomena says is, okay, I'm ordering all of your pathology redone. And I said, why? She said, because the results are only as good as the eye of the person reading the slides. Oh, I thought it was science. I didn't know there was an art to this. The next thing that happened was that, I had read the pathology report because I had to transfer from this one hospital to another. And like I said, I'm not a scientist, but there was a sentence in there that I found really disturbing, but I didn't know what it meant. And during the appointment with Dr. McAndrew, she said, it's very likely I'm going to prescribe chemo because of this. And I said, because of what? And she rolls her chair over next to me. She shows me the pathology report, and she shows me the exact sentence that had bothered me. And it said something to the effect of, they could not ascertain whether or not there had been vascular invasion. So it was an open question as to whether there were any cells running around or not, beyond what one would expect for somebody who had at that point, it was a stage 0. There was nothing in the lymph nodes. And so anyway, Philomena ended up prescribing chemo, and the rest is sort of history. I had 2 additional primaries, one in 2005 and 2009. And for both of those, at 2 different hospitals, my case ended up going before tumor boards. And tumor boards are multidisciplinary reviews of your case. So they can function as well as second opinions. And in those 2 cases, the prescription of my doctors ended up being confirmed by the tumor boards. So a second opinion can sometimes reverse what you find out, or it can confirm it. But at the end of the day, part of my advocacy is that, we all feel fear, right? But we have to feel the fear and do it anyway. Find a way to find the courage to request a second opinion, and at the end of the day, if the doctor you are with is upset about this, well, maybe that's not the correct doctor for you. Because another thing about that first doctor that I saw was, regardless of his prescription, I wasn't comfortable with him. I'm a kind of person, I need to ask a million questions. I like to learn. Some people, it's different. It's different for everyone. So I urge everyone, especially with the kinds of completely gut-wrenching decisions that we have to make, with this disease that is obviously can be so catastrophic, now is the time. Don't be afraid, or if you're afraid, just do it anyway. So we're going to talk more at our table. Linda mentioned I'm an advisor to a startup company called Cancer Round. It's a psychosocial oncology company. We have checklists, like Atul Gawande-inspired checklists, and one of them is about how to get a second opinion, how to prepare yourself for that. So I have a printout for you guys of 1 page from that, as well as information for how to sign up. Thank you so much.